Nasal tracheal intubation. Wow. I love that photo too. Take a look at that. So what's happening is it looks like it's in a hospital or an OR facility. My guess is they had to stick the tube down this girl's nose. And my guess is they had like partial trismus. So they couldn't open her mouth up wide enough to actually intubate her orally. And her mouth is only opening a little bit. So what they decided to do was pass it through her nose. The doctor shoved his fingers in there to guide the tube into her trachea. So this is kind of like a digital assist with a nasal tracheal intubation. Pretty interesting. Believe it or not, nasal tracheal intubation used to be a lot more common than it is now. There's several reasons why it's not that popular anymore. One of the reasons is, which I think is obvious, trauma to the nose. You can cause epistaxis, right? You can cause bleeding in the nose, and you have a patient laying supine. Now, all of a sudden, you got blood in the back of their throat. You're trying to suction while you're trying to intubate. It's a nightmare, especially if you can't have access to the mouth. Let's talk about why it's indicated. Why the hell would we ever even consider intubating somebody through the nose? Okay. The first one is your patient is semi-conscious, which to me sounds insane. Okay. If my patient was semi-conscious and I'm deciding to intubate them, I'm just going to knock them down. Okay. I'm just going to sedate them. I'm going to use RSI. Once they pass out, now I'm going to intubate them. But guess what? Test questions aren't written like that. If my test question tells me that my patient is partially conscious or they're semi-conscious, you must think nasal tracheal intubation is on the table, okay? They might be trying to hint at you that this patient could have a gag reflex, and we need to consider nasal tracheal intubation. We can access the oral pharynx with a Miller or Mac blade. Another one. If my patient has trismus, if my patient is unable to open their mouth, can I perform nasal tracheal intubation? And the answer is absolutely. And that is typically where they're trying to go with nasal tracheal intubation nowadays. If you're unable to access the mouth because of whatever reason, either it's wired shut, maybe the patient has trismus, maybe they have some sort of damage to their mouth, maybe you can consider going through the nose. Another very viable option is cricothyrotomy. But got to talk about nasal tracheal intubation because I'm still seeing it on EMS tests. Unfortunately, is what it is.